We were able to transport to the Westfield Hospital, and the staff there was, with the equipment in-house, able to determine that she had a severe head injury and to treat that. Without a doubt, you know, if you don't have this connection close by within the golden hour that we need to keep people treated, that child may not have made it.
It doesn't make any sense to me why they'd want to shut down, you know, a hospital like Westfield that serves such a large area. I mean, we may not have a lot of populi in this area, but we also are the gateway to New York State. Instead of a 1 hour turnaround, now you're talking, you know, maybe 4 hour drive to Erie. You're putting the patients at a greater risk, the crew at a greater risk every time we go out in the wintertime.
It's just, you know, for us, we're bewildered by the fact that we would even consider closing the Westfield Hospital emergency room.
This community needs that hospital emergency room. It serves an area of close to 30,000 people, and it's a huge area. Chautauqua County is very large, and Ripley is in the corner of the county. If our volunteer fire company can't take us, who's going to take us to the hospital, and how much is it going to cost?
If the Westfield ER closes, it would take our saves to zero. It would be 25 minutes to the closest receiving hospital. That's a long time to do CPR. It means that 2 or 3 people can't do CPR that long. It's physically not possible. You couldn't put enough people in the ambulance to do CPR that length of time.
I'm one of the patients from Westfield. 5 years ago, I had a heart attack. Really didn't know what was going on. Went to Westfield I was taken to Westfield, and I was there maybe 10, 15 minutes. They evaluated what was going on, stabilized me, put me on a helicopter, and flew me to Erie.
If I was actually born in the Westfield Memorial Hospital, I just feel that without the Westfield emergency room, there will be many, many lives in this community that could be lost.
We have a community of many elderly people who have lots of needs for emergency rooms. Also, we have a lot of Amish people that live in nearby areas that do use the emergency room. Can you imagine traveling by horse and buggy a long distance? I certainly wouldn't want to. We need to keep Westfield Memorial Hospital emergency room open.
70% of our calls go to Westfield Hospital. We do probably about 185 to 190 calls per year, EMS calls. This does not include fire calls. If Westfield Hospital emergency room were to close down, it definitely would have an impact, and it could cause lives. It caused people to die because we could not get them to an advanced emergency room quick enough. If we go to Erie or to Jamestown, you're looking at 45 minutes, and your golden hour is pretty much gone by then. If the patient is critical, either an illness from a trauma, they get them out of there really, really quick. They have Star Flight out of Jamestown, Lifestar out of Erie, or a Mercy Flight out of Buffalo.
It's multiple townships that immediately are served. Obviously Westfield, Portland, Chautauqua, Ripley, Pomfret, and moving further south, the town of Sherman. Those areas are probably the most significant users of the facility, but in a crisis. And a good example is the recent flooding we had in Silver Creek. The Lakeshore Hospital was overwhelmed, and the area was flooded. WCA's hospital was flooded. Brooks and Westfield were the only 2 hospitals accepting patients, and leaving it to one hospital would not have been able to cover that particular situation. And that's just one small event when you consider the size of the county. It really affected one township out of the 27 townships. This is a facility that provides service to people from the New York State Thruway that are injured.
911 emergency.
And that stretch between the Pennsylvania state line and halfway to Dunkirk. So it can really impact not only the residents of the county, but people who are passing through this county.
To Westfield at 1521.
We've heard over and over again, because we provide medevac helicopter service, well, we can just medevac these people to other facilities. Wrong, because we're restricted by weather. We're restricted by the use of a single helicopter. If that helicopter is in use, it might be in Pittsburgh, delivering a patient to a hospital when we need somebody transported from the Westfield area. It's common sense. This hospital emergency room has to stay open. It is our primary care facility for the inmates of the Chautauqua County Jail. We have to transfer those inmates from the jail to Westfield Hospital. If that hospital emergency room was not available, it would add an additional 25 miles of transportation for that inmate each way to either Brooks or WCA in Jamestown. The decision to close this hospital was based on numbers on a piece of paper and not logic. We're pleading with anyone in the state that has the authority to reverse this decision to do it immediately.
I look after Mrs. Kofit here, who is 99. She was here when they put the hospital in. She's very upset with thinking the emergency room is going to leave. It's close by. It's a long haul to go to Erie in bad weather.
We're working to do everything that we can to keep the emergency room open. It's a matter of life and death. This is very important to this community. We live in a rural area, and we need to have access to quality health care right here. And if people can't get to the emergency room, it's going to have a bad outcome. So we're working hard in Albany. I've hosted several meetings with the commissioner, and I'm hopeful that we can have a positive outcome.
I use the emergency room in Westfield. I want it to stay open all the time.
I don't think we should leave that, lose that hospital or the emergency room, because it's just another step towards cutting off our services around here. I was born in that hospital, and I've been taken down there a couple of times on emergency things, and so is my mother.
We really need that there. If they move it, then we will have no place to go. Please keep it open.
To keep the Westfield Memorial Hospital open is very important. It's going to affect a lot of the community, and I don't think we can afford to lose the emergency room.
I think it's very important to everybody around here. It's very quick, convenient. They're very nice people. I know the Amish go there a lot, actually, and if they had to go somewhere like Jamestown, that could actually cost them their lives.
So I'm asking Albany, Governor, are you listening? Keep Westfield Hospital open, please.
A couple of weeks ago, I had one of chest pains, frightened me. I walked over to the emergency room. I was taken care of immediately. No problems. Now, I have to drive 30 minutes over to Dunkirk. You want to be on the highway when I start getting serious chest pains and have me in the car behind you? I don't think so.
I've had to deliver 2 babies myself just in the ambulance because time is the essence, and sometimes you just don't have that kind of time.
I think it's a total disaster. The ER here saved my life a couple of times, and if it was the closest place I could come, and that's when reason I'm here today is that the ER was open and able to take care of me.
When I sit here and look out and watch the traffic and see the numbers of ambulances that come in here just while we're having our rehab, you know that it's very important. Nobody should be without the quickest service they can get.
I think it would put a whole lot of people in danger if they closed this emergency room. This is a rural area. It's a long distance to some of these other hospitals. Time is of the essence when it's an emergency situation.
I've worked here for 8.5 years, and I've seen the incredible volume that we get in the summertime, where we get 40, 50 patients a day. I'm lucky where I've been able to work at Brooks Hospital and WC Hospital, so I picked up shifts there, and I understand the patient volumes, and I understand how overwhelmed those hospital emergency rooms can be. The critical role we play here, when someone presents with a potentially life-threatening problem, whether it's abdominal pain or chest pain or someone who has a head injury, the assessment of those injuries, sure, someone who hits their head, maybe 1 out of 100.